Today we are talking about digital care pathways in practice. Here with me, I'm Virpi Rauta, nephrologist from Helsinki University Hospital, and next to me here is Laura. Laura Mäkitie, neurologist, who will tell you about the headache care path later on. And then we also have here Jörgen Grön, who is a digital healthcare lead from Innofactor, and he will help you with the questions. Well, let's start with nephrology and the Kidney Hub in the digital health village. And which digital paths we have in the Kidney Hub designed and why. Well, just to give you some background to this issue, kidney failure in general is not that uncommon. Actually, every 10th in adult population have some kind of kidney failure. It doesn't always progress to end-stage kidney failure, but in case that it does, there are basically two treatment options. First of all, kidney transplantation or then dialysis, which is artificial kidney treatment in most cases with dialysis machines. Kidney transplantation is not available for everybody, but is the best treatment choice. If that is not possible or available for the patients, dialysis is there for the patients. Dialysis treatment can be personalized and tailored to meet every patient's needs very nicely. But it is probably good to know that it is the most expensive life-supporting long-time treatment in the world. And it does matter what kind of dialysis treatment we choose for our patients. Home dialysis is practically a win-win-win treatment. It is win for the patients. It gives the best quality of life for the patients and better outcomes. It is win for the taxpayers, and it is also win for the hospital districts or providers. And this is why we decided to build our very first digital care pathways, on the other hand, to promote living kidney donation, and on the other hand, to promote home first dialysis program. We have several digital care pathways already in patient use. We started with Diamine, as we call this digital care path, which you can see here on the screen now. This digital pathway was, we started with the patients, this digital pathway in December last year. And in the same time, we started with the living kidney donor pathway as well. As you can see here, Diamine is, first of all, it is quite a good example of how digital care path can help to take care of the patients with chronic conditions and in long time follow-up. It's pretty comprehensive package. We have there huge amount of information and huge amount of different services. This pathway, in the beginning, when the patients come to this pathway, they come in the pre-dialysis phase when no dialysis is taking place yet, and it helps the patients to choose what kind of dialysis is best for him. There is huge amount of videos of patients fellow patients doing dialysis at their own homes and telling why they chose that treatment for them. There's navigator to help patients to choose the best treatment choice for them. Huge amount of information about dialysis in general. And patients can get familiar to all this information in this digital path. And what is important as well, that since we promote Home First program, the patients can, whenever they have time, share this information with their nearest, with their family members as well, and they can together at their homes discuss if this is good for the patient and the family as well. The actual dialysis modality decision is done with the professionals in the hospital, but all the information continues to be given in the pathway. Even when the patients start dialysis, they can learn in the digital pathway how the dialysis is in practice done. There is lots of very step-by-step catalogs how the dialysis is done. And there is all the time message channel where the patient can reach his treatment group nurses and doctors as well. This is secured channel for discussion. We also have e-visit option in here, and that is what patients have liked a lot as well. So this green circle here in this picture shows how the patients, when in dialysis, they keep on being in this green circle and have all these services we have there. Practically, the patients in home dialysis stay in this digital care path as long as they stay in home dialysis treatment, and that can be years or even decades. So lots and lots of information and all in the same place and easy to find. Well, we know that there is, and we have thought that there might be quite a lot of benefits for our patients. One important thing is that they have access whenever they want to browse the material and discuss with the care team. And as I already told, in our patient group, it's very important that the patients can show the material to family members and share the information. It is also important for the patients that they have the same up-to-date training material that all the other patients also have. They can be sure that they have been delivered all the material. We have also noticed that since home dialysis training takes time, and for some patients it takes more time, it is good that the training material is already there before any training in the hospital takes place, so they can get familiar to what we expect them to learn and how. So they are more ready when they start their training, and the training periods can even be shorter than before this digital care path was available. It is also very important that the patients can go back and forth with the information in the care paths repeatedly. And these remote video visits are good as well. We have already had this in use for now 11 months, and last August we made a query to our patients who already were in this care path, and we asked them basically their satisfaction of this care path, and it was pretty overwhelming. The patient found that this is clear, logical, it is basically a very good idea, and easy to use and understandable. The feedback was very, very good. What I wanted to show here is that we very often hear that this kind of services are for the digi-native citizens, but in our hands, 26% of our users in Diamine are 70 years or older. So this is what we are very happy about, since our patient group is quite old. So what about the professionals? How about our nurses and our physicians? What are the benefits for them? First of all, this is a very structured model for increasing proportion of home dialysis. It is built in there. It is easy to follow, even for the new nurses. And there's everything needed in one place, easy to find for them as well. This serves also as a very good training material for our new nurses, and as our training physicians as well. This has freed our staff from some routine work. First of all, there is not at all any printing anymore. All the information is in these paths, and there is also less phone calls. And the staff in our hospital can be certain that they have given all the material for the patients, and this increases the quality of care. We have very good dashboard and patient listings, which helps our nurses, and many of these qualities in these care paths really do better our patient safety and lower the risks. When we started with our Diamine care path, we made some estimation about the cost benefits. And as you can see here in these light blue bars, we estimated that in 2022, we might already have savings of 1.6 million euros per year. We have already shown that the other very interesting thing here, it was estimated that the break-even point for these pathways would be within 1 year, and this is what has happened for Diamine already. All in all, our healthcare professionals in our kidney units feel that there really is no turning back after taking these digital tools in use, and the same message comes from our patients as well. When we made this patient satisfaction query, there was very clear message that why didn't we have anything like that before, and this is something that everybody really should have when this sort of patient group particularly. Thank you. I wonder if there are any questions available.
Hi, Virpi. There's no really questions from the audience, but I have a few questions, so okay. Maybe I can fire the audience up a little bit. First of all, I would like to say hi. My name is Jörgen Grön, and I'm working from Innofactor in Sweden. I've been talking to Swedish market for a long time, and yeah, that's my picture coming up there. And the thing that I really want to is like to make sure that Swedish society and all the patients will have a high quality and engaged digital healthcare. That is what my motivates to work with this tool every day. So thank you again, a great presentation regarding the Kidney House. But if we go back for a little bit, what was the main driver for Health With It to have the Kidney House? Because that is like the starting point. So what was the main for Kidney House?
Well, I believe that one main point is that we are dealing with a small but very expensive patient group, and these patients are they need a lot of attention from the professionals, and we know that the quality of the patients in these treatments is not that good, and we have to improve all these issues. And it was felt that kidney patient might serve as a very good example for a patient group of chronically ill and needing long-term treatment.
That is great.
Did I answer your question?
Yeah, it was really great, and there was also thirdly that it is the type of patient group, the volume, and so on. So, but when using the digital care path as a patient, what 3 top benefits have you heard from the patient when using it?
The amount of information they get is larger, and all the information is in the same place and easy to go back and forth repeatedly. Before, we used to give a lot of verbal information, and we all know from the studies that when we give verbal information to our patients, most of that is forgotten already when they leave the outpatient clinic. So all the information is now in these digital pathways, so they can find it. Our patient group particularly, they need huge amount of information about the diet and about the social security issues and about these treatments and medicines and lots and lots of things. So now everything is in the same place, and they can be sure that all the information they get from these digital pathways is accurate. All the information is done given by university hospital professionals. They can rely on the information. That is what they really like as well. And what they like too is that we have really focused on to deliver the information in easy form to digest, so it's understandable as well.
Great answer, I like it. So when the professionals are building up all the content and work with the patients, has it been an easy work tool for you as a profession to have it as a daily work tool?
Well, I need to admit that this is a change process. So it has been in some parts easy, but there is the nurses particularly, they need to change the way they have worked. And their profile, the nurse's profile has changed quite a lot, and we needed to change our processes in the hospital as well. So these digital care pathways are not something that you add to everything else you have been used to do. You have to get rid of some old ways to take care of the patients as well in the same time when you take these care pathways in use. So it is a change process, but in our clinic, I think we have managed in that very well because we have strong support from our administration in the clinic to these programs, and they are very they really want to have these in use, and we have many nurses in all our units who are very involved in building and developing these digital paths further. I really think that many of our nurses have nowadays some kind of new subspecialty, and that is digital care pathway nurse or e-health nurse as their subspecialty nowadays. And I think that it is very, very important that as many as possible in the clinic, they really want to develop these tools further and be involved in these processes. And that's what has happened in our clinic as well.
Great answer. We have been getting some few questions from the audience, so that's really good that they are starting to fire it up here. We have one from Pekka here, and he writes, where do you need to improve or develop the service further? Do you have any like specific areas that you would like to hit on, Danae?
I think that these services are something that need to be we need to make them better and better all the time. We need what our patients ask. They want to have more interactive elements in the pathways, more questionnaires, and all in all, more interactive elements. And that is what we are developing right now. For example, chats. And some intelligent tools as well, but these are on the way.
Great, that's cool. Then we have Brian here also from, I think it's from Canada. That's really nice to hear from him. And he would like to try to get this Terveysköla Health College to Canada. How could we make that established?
Please contact us. Later on in this webinar, we will give you our emails, and just please contact us. For example, Diamine is now available outside our hospital district, so it is available.
That's cool. So Brian, you probably heard that. And then another question also from Brian. He is also talking about, do you have plans to create interactive components to support communication between patient and clinicians? So
sorry, I didn't get the answer now. I didn't get the question. Can you repeat it?
Do you have plans to create interactive components to support communication between patient and clinicians, like bots or maybe some machine learning and artificial intelligence?
Yes, we do. Yes, we do, and they are on the way actually already.
Well, that was the questionnaire form from the audience. If not, let's see if some. Yeah, we have one from Jan here also. Neuropath, Belgium. Do you think that digital care path help to avoid clinical burnouts?
Clinical burnouts of doctors and nurses. Well, that is interesting question. Probably in that way that we truly believe that we can take care of more patients with the same amount of staff. So in that way, yes. For example, in dialysis population, it is growing all the time in Finland and in Canada and in all around in Europe. Dialysis population is growing 5% per year, and we really are not getting any more staff. I believe that is very, very hard. So we have to find solutions to take care of the patients and safely take care of the patients with this stuff. And I really believe that these are the tools that can help us. So probably it will help also to avoid staff burnouts.
That is good, to make sure that you're going to live longer. That is the most important part that we have, to rescue us all the time. Yeah, so we have one question from Pekka also, that is a little bit of more technical part. Let's see, Virpi, if you can answer. Are the solution available in mobile for iOS and Android? Or should Aki maybe answer that?
I believe that Aki is the best to answer now.
Okay, yeah, well, the solution currently, it's built as a responsive solution. So basically it is available on a mobile, but it's not really built into a mobile application so that you can download it from an app store. that is something for next year's development. So it will be, but it's today you can use it on a mobile, but it's not really built as an application. That will come.
Great. That was all the questions that we had. Thank you, audience, for participating and giving questions. So Virpi had some few questions to answer. Of course, we'll be staying here, so more questions can be coming out later, and we can try to answer them later on. But now it's time for next speaker, Virpi.
Yes, thank you. With James here.
All right. My name is Laura Mäkitie, and I am a neurologist. I work in Helsinki University Hospital. Half of my working hours I work as a consulting neurologist, and the other half, for a couple of years, I have been building digital services for our patients. Okay, so what I'm going to tell you today is about Heather, which is a digital service for headache patients. It's a digital headache therapy. And it has been built here in Helsinki University Hospital by a group of professionals. We have had headache specialists, neurologists. We have had nurses who are specialized in treating headache patients. We have had pain psychologists, and we have had physiotherapists, and we have had a couple of patients also to advise us. The digital care pathways can be divided in 3 categories in Health Village. Virpi was telling you about the number 1, digital care paths for chronic diseases. And there are also care paths preparing for an operation. And Heather is this category 3, coaching therapy. And here you can see an illustration of Heather pathway. The upper half of the picture shows the eHealth service, and I'm going through it with you so you can understand what the service actually contains. Headache treatment or the care process always starts in meeting the neurologist or doctor. First, we have to diagnose the headache. Headache is a symptom, not a disease, and we have to know whether the reason for headache is episodic migraine or chronic migraine or tension headache or medication overuse headache, for example. And all these headache types that I mentioned are suitable for Heather care pathway. In the first visit, after the diagnosis, we also choose and start the medication for headache. And after that, the patient can start to go through the digital care pathway, in which the first thing is to download the mobile headache diary to their mobile phones. It's free for them, and as you all know, the mobile phone is always with you, and it's very easy to report headaches with the mobile diary. In addition, for the headache itself, we also ask the severity of the headache, the duration of the headache, whether the patient has taken any painkillers for the headache, if there was any predisposing factors for headache, and also whether they have been absent from work because of that headache. And all this information, or filling up the diary, it takes about 1 minute or less. And the report will be saved in Heather Digital Care Pathway, where the patient can see the whole reports, but also the professional, the nurse and the doctor can see them. And this is very elementary for the treatment, because that is the way we can remotely monitor how the patient is doing. Is the treatment effective or not? After that, the first thing actually is the ABC of headache medication. And especially in patients who have chronic headache, meaning that they have a lot of headache days during months or even years, they are used to take painkillers. and unfortunately some of them get medication overuse headache because of the excess use of medication. And the first thing is to get rid of this medication overuse headache and the excess use of medication, because any other treatment of headaches is not working at all if we don't get rid of that. And that is the first thing we support, guide through the patients with this process, which is not easy. We have a lot of questionnaires, rehearsals, exercises during the pathway, which helps patients to recognize, for example, the lifestyles or the habits like excessive use of caffeine or sleep deprivation and so on, which might predispose of having headaches. And by not just reading through some information, but to stop thinking of their own individual situation helps the patient to understand better their own headache situation. A very important thing which we have here is psychological headache management. It is based on the fact that, especially in chronic pain, the medication can help to decrease the pain maybe 20%, and the psychological management, basically meaning cognitive behavioral therapy, is at least as effective. And this is not something we usually can provide to the patients, because unfortunately we don't have any psychologist on our clinic, and I know that the same thing is merely in quite many places where the headache patients are taken care of. So we have built this whole psychological headache management here in Heather, and the patients go through it on their own time, on the pace that suits for them. As well, we have physiotherapeutic intervention in Heather, which means the patients learn which is the best way to work with a laptop or use the mobile phone or just walk, stand, sit. And also there is a lot of rehearsals for relaxation, which is known to be effective in pain management. And then we have also this startup program for physical exercise, and it's very important for headache patients, because quite many of them has totally quit off exercising because they are very frustrated of their headaches, and it can even be if you start very intense exercise, it can cause you headache. So it's important that these people get back moving, get back exercising, because it is a very effective and good way of actually decreasing headaches. After the patients have 8 months to go through this pathway, there is a lot of information in different forms, but there is also plenty of time to go through it, and it's very important that the patient doesn't rush through the pathway, because the whole point here is to learn something, to understand something, to change the way we have lived before, and make changes and kind of tackle the headache, and it takes time. In the upper row you see the professional. There is the first visit with the diagnosis and the medication startup. If the patient does well, if we see from the mobile diary reports that the headaches are decreasing, then we don't necessarily have to contact the patient anyway, but I think it's important still have some contacts with the patients to attach them better for these services, for example, and give them secure feeling of the treatment. And that can be e-visit that can be face-to-face visit or just normal phone call with the nurse or a doctor. And in the end of the care pathway or the care process, we also like to meet our patients and kind of have this checkup that everything is fine. After the care pathway, the patients have limited access to Heather path, which means that they can see all the information that is included there, but they cannot fill any new questionnaires or they cannot send any messages to the nurses as they have been able to do before. The chronic or the headache, unfortunately, is a state from which you don't get rid of usually. So it's possible that the headaches come back, and it's very important that you have also later on the information available for you. Okay, in neurology and in Health Village, we have a principle that when we build and design new e-health services, it's obligatory that these services provide benefits not only for patients or not only for healthcare professionals, but for both of them and also for the organization. And this is the only way, in my opinion, to make an e-health service that will make some profit to any stakeholder, including patient. So what are the benefits for the patient then from Heather headache treatment path? Obviously, the main point is to decrease the amount of headaches, and that's the most important thing. But when we have been designing and building this e-health service, we have been kind of checking the whole care path of the headache patients, and we have been building actually a holistic care treatment path for these patients, and it means, for example, that now when I meet a headache patients, there is not on my patient list, there is not a headache coming in a female head, but rather there is a female coming with a headache. So I consider the whole patient and the life of the patient, not just his or her headache. Mobile headache diary is a very good thing for the patients. They used to carry around the sheet of paper where they had to mark their their headaches, and you can imagine in what shape is a sheet of paper after 8 months, for example. They can easily contact their own nurse via this Heather pathway, sending a message, and it's much more easier for the patient, of course, than wait for the phone appointment time of a nurse or hang on the busy lines. The patient gets a lot of different kind of tools for headache management via Heather, and that's much more than just the medication we have been able to give them before. And the real idea of the Heather is to provide insight for the patient of their individual situation and their headache, and make a change in their life and empower them also for the future to tackle the headache and master their life instead of headaches telling them how they are able to live their lives. Okay, what about the organization? What would be the benefits? Headache is a very common thing, as you all know. There is a huge amount of headache patients, and actually headache is one of the leading causes of sick leaves in whole world. And there is a lot of patients waiting to see a neurologist or waiting to see a doctor, and with Heather, and we can treat much more patients with the same amount of time or same amount of professionals, and we can also increase the quality of the treatment and the care, providing the psychological and physiotherapeutic treatment with Heather. And the benefits for the professional, for the doctor and the nurse. When I have a headache patient and I have started medical treatment and the digital e-health service, I would kind of like to know whether it helps or not. So this digital follow-up system with the mobile diary is a very good and easy way for me to see whether the treatment is working or not. And if it's not working, then I can change the treatment plan. If it's working, I'm not needed. So that is a very good benefit. Some of these headache patients, especially in university clinic, are really the worst of worst headache patients, and they are very difficult to treat. And I have to say that I'm almost grateful that I now have something else than just the medication to help my patients with. So that's really is a big thing to have this interdisciplinary treatment included in Heather. The e-health service, which is designed to kind of change the whole care path, also makes it very structured. We have the first visit, and the patient can start the e-health service, and then we see how he or she is doing, and the whole process is getting more structured with this e-health service. Then with some patients, or all the patients filled up the questionnaires in their e-health service, and especially in cases where I find that the treatment plan is not working, the headaches are not decreasing, I can actually, with a very limited or very fast, check the individual situation of a patient having headaches of the questionnaires they have been filling up. For example, if 80% of the patient's headaches is predisposed by sleep deprivation, then it's obvious that if I don't do anything for sleeping, then we never get rid of the headaches. It's very fast to check the facts from Heather, much faster than call to the patient or ask and have a conversation. Very important thing also is that with this e-health service, the headache patients are not just taking pills and waiting for pills to take the headaches away, but rather the patients take much more active role in the healing process, and they take responsibility over getting better and controlling the headaches. And that of course makes my life much more easier as a doctor. Okay, I think that was all that I had in mind about the Heather and headache service, but I'm pleased to answer any questions if you have in mind.
Well, that is great, Laura. I have seen questions coming in here, and I also want to start with a few other questions first, so we can energize the audience again here. So when working with a digital care path, what has been the best wow effect for the professionals? Because you have so many things that are great for the professional, but what is the wow effect?
I think I think for all of us, the best thing has been the understanding and the possibility to help our patients better, because now we don't just, as I told you, we don't have just the pills to take, but now we have the whole psychological treatment and all the physiotherapeutic help, and we can provide them all to our patients, not just some very special cases. So that, I think, has been the best wow effect for professionals. The nurses are pleased also with the message channel, because it's easier for them to deal the patient's questions via the messages than with phone calls.
That's great. Has there been any measurements regarding patients' improvements, and have they been faster getting better?
Well, not yet, because we have only a couple of patients that have actually gone through. This is quite new thing for us, but we are doing it. We are starting the efficacy research, so it's very important thing to show and to check whether this is helping the patients and what kind of benefits we actually are getting.
That is great. So also when you are not working with a new tool like going digital all the time, has the workload with the digital care path improved the workload for you guys, so it not having like a burnout like for kidneys?
It seems that it has. The first thing is we have this is not the only e-health service we have. We have 4 others also. So it seems that the patients are not calling anymore to the nurses that much, because there is so much information on the e-health paths. So it's making the life of the nurses easier. Also on the ward, we have some operational paths also. The patients are more informed before and after the operation, and it makes the life of the nurses easier, and they can concentrate on individual problems of the patients better.
Great.
For as a doctor, it makes my life easier also, because I get more structured information of my patients when they have filled up these forms and questionnaires. It's faster to check these details from the e-health service than ask the patient.
That is good. One more question for me, and then I will let the audience come in, flying in a lot of questions here. But going from the old way of working more analog, like touching the patient, meeting up in private person, and now going digital, has the transformation to work from going from analog to digital, has that been a hard thing for you to do?
Actually, that is not what we are doing. There is much more patients out there than we can actually help and treat. And with these digital services, we are getting rid of, if I could say so, we are getting rid of those, for example, routine face-to-face contacts, and we are giving time for those patients who kind of get more of meeting a neurologist or a nurse. So we are not trying to we are definitely not trying to get rid of meeting the patients. That's the best part of our work. We are just kind of putting our resources to there where it's giving more benefits for everybody. So it hasn't changed that much, our work, or at least not the amount of being actually with patients or touching the patients or talking to patients.
That's great. We have a question from Jan here. He asking, do you already have a digital care path ready for people with Parkinson's disease?
Yes, we do.
So is the structure and structure similar the way as you showed in the presentation?
Well, it's more like what Virpi showed you. This is Parkinson's disease is chronic condition, and that e-health service is available for patients as long as they are with us, which means 8 years, 9 years, 10 years. It's concentrating on information, self-care instructions, and symptom navigator, for example. So it's a different kind of service.
Great. Another question from Jan, and I try to, is there any cost involved for the patient or the user to use Terveyskylä's Health Village?
I believe not at the moment. We have chosen in the beginning, it depends on the service. There are services that there is a bill going to the county, and there might be some, I'm not sure if patients has to actually pay something, but in neurology, these services are free for patients at the moment.
That's great. We have one from Magnus here. Are you planning to, or are you already using remote patient monitoring solutions, i.e. tracking sleep or something like that?
In neurology, no. We are building an e-health service for stroke patients, and there we are going to apply the remote blood pressure measuring. We have tested ECG measuring also remotely, but that's a little bit more complicated. And for the Parkinson patients, we are going to take this Parkinson kinetic graph remote monitoring system and integrate it to the Parkinson e-health service. So not yet, but plans are to take this in the future.
Yeah, a lot of plans then. So what is the estimate? This is a question come from Pekka. What is your estimate? How many patients would be using the service later, like from a year now on?
Well, that's actually a big challenge, or the biggest challenge we have here. It's not easy to, as Virpi told you, it's not easy to change the way we work. So we have to remind our colleagues to use this service with patients, and it's not, the headache patients are mostly very busy persons with little kids at home and a lot of work to do. So the problem is how we get most of our patients to use this. For the first years, the goal is to have at least 150 active patients on the Heather, but I'm positive that we can at least triple the amount in a couple of years when we have tackled the challenges here.
That's great. So how can you also reach out to the society to make sure that they understand that this kind of tool exists for them also?
Sorry, could you repeat it, please?
How could you reach out to the society so they understand that this kind of tools are available so that you can get more patients?
Well, we have used Facebook and Instagram, and we are contacting the Migraine Patient Society for that. But actually, I don't think it's the most profitable way to kind of try to reach the whole nation, but rather concentrate on the people who come to our clinic and who actually have the headache. And these patient organizations are actually very, very good way to inform the people of the service also.
We have from Margaret also questions here. It is 2 questions as I can see, but I thought, how long did it take to fully do the implementation of one pathway?
Well, for the first one, what would I say? Well, let me say, for the first one, maybe a year, but that was also the first ones in the whole hospital. Now when we start building a new one, it takes maybe from 3 to 6 months, maybe. And you have to remember that we are doing this in addition to our normal work, mostly.
Well, that is going from a good pace to even better pace then.
Yeah.
Yeah. So also, how does the organization choose which care team will be the next to be onboarded?
Well, I have to say that I have had quite a lot of freedom to choose these patient groups, but of course we consider the amount of patients and the amount of contacts of patient group. And very important thing actually is that you should start designing and building this kind of service with those professionals who are enthusiastic or who think that there is a potential, because that's the way of getting something ready and getting something done. So we have covered now in neurology all the main symptom or disease categories, but it's mostly because our professionals have been ready to do this. And I think it's actually a good way to choose the patient groups or the goal.
That's really good. And so now we have an understanding that the first one takes a little bit longer, and then it's a more like spinning off from the first one, and then the time's going, and also who to find is the most enthusiastic or the person that's really want to reach out with the digital care path for the patients group. Yeah. I can see the time is flying here. It is only 30 seconds left or 60 seconds left here. So I can't see any more questions here. And I'm really thankful for you answering my questions that I had. And also I hope that everybody else was finding all the questions also that we took here. So over to you, Laura.
Thank you all on my behalf and all the organizers and presenters. I hope you enjoyed and had something interesting in our presentations. Here you can see the contacts. There is Virpi and me, our emails where you can contact. And if you are interested in, for example, more information of Health Village and these services, there's info@healthvillage.fi. Thank you all.